Name is Nina Shaban. Michelle, back to you.
Thank you, Nina. Let's take a look at what's making headlines in the healthcare sector. And the M-pox transmission in the country is now in the community phase, and infections are expected to increase. This is according to the Ministry of Health, which has also confirmed Kenya's 5th patient who contracted it locally through a contact here, and not a case of someone coming into the country with the infection. The Ministry of Health has elevated surveillance and is exuding confidence in the situation. However, as Bridget Ngana reports, an impending nurses' strike in the county of Nakuru, where a patient has been isolated, could affect the county's response to the viral illness.
The Ministry of Health says the country has now registered 5 people who have contracted Mpox. However, this latest diagnosis is the first to be locally transmitted.
The cases that we had before were mainly imported cases, but the 5th case is suggestive of community transmission having started. We will also start seeing a spike in the number of cases.
While this may be a cause for concern, the government says it is ready to deal with the situation as it evolves.
I want to assure Kenyans that we are having heightened surveillance and lab diagnosis is ongoing. So we have the right capacity for diagnosis and training as well.
We are able to look at the genetic formation of these pathogens, and we have been able to classify that the first case was clade 1B. We actually categorized them into clades. It was clade 1B, which is more severe and which is circulating mainly in Central Africa, which was imported into Kenya.
The country's 5th patient is linked to the 4th one who has been in isolation in Nakuru, but medics say the patient will soon be discharged. This as health workers in the county are on a go-slow over delayed payment and lack of sufficient training on Mpox prevention.
We have a problem with shortages in our facilities. You find one nurse managing like 40 to 60 patients. Is that really in order?
We have Mpox with us. We are looking at laboratory all the time. Everyone else goes to the trainings. We can get infected, but we are not considered.
In this financial year 2024-2025, we have ring-fenced each budget for human resource to enable us to recruit new staff, to replace should they leave, to promote and to redesignate. So it's something that we are addressing progressively.
Since the counties began recording cases of Mpox, the Council of Governors Committee on Health has asked the devolved units to avail resources for the emergency response to this global public health concern. Here in Nakuru, the Bondeni Sub-County Hospital has just been identified as one of the isolation facilities outside the Nakuru Teaching and Referral Hospital. Bridget Ngana, NTV, Nakuru.